Today we're looking at what actually happens when a horse is placed into head and neck flexion without the rest of the body supporting that posture, because head position alone does not create self-carriage, collection, or correct biomechanics. But firstly, thanks so much for listening in. This podcast exists because we are committed to providing you with the best information so you can improve your horse's posture and inspire others to do the same along the way. If you believe that what we have to offer can change your horse's world for the better, we're asking you to support our mission by subscribing and taking a few seconds to give us a 5-star rating on whichever platform you're listening to. We would be especially grateful. Wonderful. Hi everyone, this is Dr. Raquel Butler from Integrated Veterinary Therapeutics.
And Sophie Vandenberg from Equine Postulate. And we welcome you to the Equine Functional Posture Podcast, your ultimate source for insights into the influence of functional posture on biomechanics, health, and overall well-being of horses.
Whether you're a seasoned equestrian, an equine professional, or simply a horse enthusiast, this podcast is designed to help you understand the critical aspects of functional posture.
Tune in each week as we discuss practical tips, delve into expert interviews, and explore the latest research in the impact of functional posture on equine anatomy, physiology, movement, and more.
Let's create a world where we empower our horses to be in a mental, emotional, and physical balance.
When we focus on head and neck position without the whole body coming online, the poll, the jaw, your neck muscles, the cranial nerves, hyoid, nuchal ligament, and even the back and pelvis can all be affected. So today in this episode, we're going to be explaining how the true aim needs to be on the whole body, the thoracic sling, your core health, and hind end engagement, so that the head and neck can respond freely and be a beautiful product of the rest of the body rather than us having to ask it to be in a fixed position.
Yep, in dissections, I do a practical, which came from Sharon May Davis, where I get people, it's generally towards the end of the dissection, but I get people to slide their hand under the nuchal ligament around C1-2, and I get them to feel the tension there while I place the head and neck into flexion. So I will just initially put the nose on the vertical and get them to feel their fingers, and they're often like, oh, that's a bit uncomfortable, even just when the head is on the vertical. And then I'll take it into a deeper level of flexion, not necessarily into all the way to roll curve, because before I get there, they're usually starting to squirm, that it's a bit painful. And then I'll tell them to leave their fingers there, and I'll lift the sternum. And it's amazing how, the head and neck will go into a functional position when I do that. I have had dissections, though, where the horse has been compromised and been unable to actually lift through the sternum, and we definitely don't get that effect. In the last dissection that I did, I had a pony on the table, and when we did that, we were also able to engage the hind end as well and show how in that position, like the nuchal ligament expands in both directions, so that the hind end can come under and the head and neck are lifted, but there's not a stress on the nuchal ligament. So the nuchal ligament connects from the occiput into the supraspinous ligament at the wither and then continues along the supraspinous ligament all the way to the tail. It also has 2 sheets like on each side of the neck, and they join together in the center. And then it has a laminate portion that is connecting down into the neck vertebrae, which generally only connects down to about C5 with strong connections and maybe feeble fibers to 6 and 7, but it's not designed to support the head and neck specifically. We're relying on the rest of the body to give that head and neck support. It gives great elasticity and great recoil in locomotion, and it's important, for horses grazing to be able to lift their head up and down, but it is not meant to be put under the tension that some horses are put under when we put them into flexion. So I love seeing the look on people's faces when they start to like think about that and what is happening when their hand is under there, and they start to kind of think about how they're creating their horse's head and neck position. Because I have done that, like I've ridden and put the horse's head and neck in a position. And the other day I was riding Belly, and I ride him bitless, and when at the start of the session he was really soft in my hands, and I've been really focused on keeping my pelvis and upper legs really open, allowing his back to come up. And then I noticed that I started to hold him a little bit, and then he started to kind of lean on me. And as soon as I let him go, he actually sat back into a really nice posture. And I was like, oh, that was interesting. As opposed to when I used to let him go a few years ago, and his head and neck would come up in the air and he'd hollow his back out, and it felt terrible. And so it's a good test to kind of let go of the reins, because when your horse is actually in self-carriage, they'll have adjustability, but they'll be able to hold themselves in that position without you doing much at all. So it's really interesting to feel that, but also to recognize that they will fatigue way, way quicker than what they will do when we're holding them there. Because when we're holding them there, they learn how to use the big muscles to keep themselves in that position. So when we do, prioritize the body above the shape of the head and neck, what kind of things happen within the body?
So you have the ability to have this lovely telescopic action through the neck, which is very healthy for the neck because the facet joints throughout those cervical vertebrae are able to remain open. And so something that is recognized in, say, sport horses and maybe show jumpers that are putting a lot of force through their neck when they are landing is that that area can become very compressed. It can be very restricted, and it's an area that can develop arthritis, particularly in the lower cervical joints, in those facet joints. So the health of those joints can be improved by keeping that neck open and have the ability to lengthen. When we see the horse creating a nice open gullet and open jaw, then that space is able to remain very healthy and have good drainage, have good hydration, and up underneath the throat, you've got the hyoid, you've got the larynx. There's a lot of blood vessels traveling up the neck, through the jaw, into the brain, and then back down. And so that space being able to be open and clear allows for good quality circulation, which is very good for the entirety of the head as well. You've got the ability for the sternum to lift and have that adjustability. That means that your thoracic sling is being activated and having good range and quality of motion. And if you're prioritizing the body, then you've got a core that is supporting the spine. The back is then able to open and lift, and the hind limbs can then step underneath more effectively. So you have this
ligament is like allowed to expand as opposed to being compressed.
Yes. And so that is what it looks like to be looking sort of, from the neck backwards at the body. There's a Manolo quote: if you short the body, you long the neck. And if you long the neck, you are often shortening the body. So we want to be able to create a lovely balance between the two. And the other bonus is it feels easy for you to ride because they're carrying you as opposed to you riding or driving them. And the biggest bonus is for your horse. They have longevity and sustainability. When the body is well organized, you have good joint mechanics. You have good tensegrity of the whole system, the muscle balance between one group of muscles to the other, and they all pitch in and do their job with small adjustments. And all of this together, reduced joint strain, reduced muscle and soft tissue strain, contributes to the comfort and well-being of the horse. And when the system, one of the principal tenets of osteopathy is that the body has self-healing and self-regulatory mechanisms. And so when everything is functioning well, you have good circulation, good blood flow, enough healthy movement, you actually see a body that maintains itself very well across a lifetime. Old horses don't have to be uncomfortable or crunchy. They can move and be happy and well, even if they're a bit older and they have grey hairs, because if they have moved well always, the body can continue to go through to maintain itself well and be self-healing. So really the distinction is that head position alone does not create flexion, self-carriage, or create biomechanics. It is the result of a whole body posture. You can't create it in isolation, and you can't force it either. So, as you were saying, you take away the reins and you might see that your horse does maintain a lovely adjustability, and that is a reflection of the body that they're working with. So for the inverse, Raquel, what happens when flexion is created by us rather than the horse?
Yeah, and I think also with that question, we have to recognize that horses themselves, like in their natural environment, when they say create a beautiful, what we consider to be a beautiful head and neck position, so there's a level of collection and self-carriage, they only maintain that for very short periods of time. So you see like the horses playing in the paddock, the horse is excited by something that's happening and they're like carrying themselves around. Well, they might maintain that for like a couple of minutes, and they can do that. But when we're asking them to do that, we're often asking them to maintain it for like half an hour, 40 minutes, or maybe we've taken them to a competition and we're asking them to over the day maintain it for 2 hours. We've got the first test that's done in the morning, or the dressage in the morning, show jumping in the afternoon, or something like that, and they're having to utilize those muscles for many hours in the day. And although they can naturally do it, it's very different utilization in those situations. Like in the paddock by themselves, they're probably using their postural muscles very, very well because they're not fatiguing them, because it's just a short period, and then they might stand and look at the thing for a minute, or stand and just do something else for a second before they go back into that movement. So we just have to consider that is why horses need us to help them create be able to hold these postures for longer periods of time, and why they can't just do it so easily. So yeah, what happens when we just create that flexion, utilize the head position more than the body creating the head position, so they can start to fix and just get fixed in the position, so there's not adjustability anymore. So they just maintain the same head position regardless. So they're also they can get a lot of compression through the back of the jaw area, and that's where the salivary glands sit. That's where a lot of structures sit between the jaw and the first cervical vertebrae. There's a lot of blood vessels, nerves. There's the hyoid, which is involved in swallowing and tongue motion, as well as we've got the bit sitting on the tongue that's going to influence that too. And so then you can get increased salivation. You can get those horses that, might start opening their mouth a little bit. It's not always excessive, just the horse that's slightly opening the mouth, or when the bit pressure comes on, they're opening the mouth. They can brace through the neck and have reduced ability to lift through the base of the neck. You might feel like you always have to push the horse because they're not kind of freely flowing forward, because basically the brakes are on through the head and neck when the head and neck is being put into a position, as opposed to the horse that's carrying themselves, which are going to freely move forward when asked. They might also feel like there's just not a fluidity of the motion going through the body. So there's a bit of an abruptness in the hand, a heaviness in the hand. You can kind of hear the difference with how the front feet are hitting the ground. So, and then that kind of creates a lot of stress and tension through the body, and then sets up for its own patterns that occur and tension, especially through the fascia, through the body. So yeah, we just want to think about that. So then if we talk about like what structures are being affected when the head and neck is put into flexion there.
So
We've talked about some of them already, but yeah.
We've talked about some of them, we're really zooming in on the head and neck area, but for example, like there's a lot of small muscles around the top of the head. You've got the rectus, tapetus, dorsalis, major, minor. It's got a lateral portion. There's also the ventralis. You've got the caudal and cranial headoblites. And there's this, there's quite sensitive muscles that go from the underside and the side of the cervical vertebra right into the base of the sphenoid, right up in the horse's skull. And so when they are having to hold a level of tension, as your horse is either maybe too flexed or on the vertical or in a way that just isn't functional for them, then you're putting a lot of strain through those structures. Either the horse has been trained to hold the position, or they are being held in the position, at which point there is still a lot of brace through all of those. So all of those can be impacted. All of those small muscles are usually used for very small adjustments, and they're nearly always in motion or resting with just a slight positive tension to hold the head in alignment. So if you imagine the horse is normally turning softly to use their vision, they are chewing, they're reaching up for foraging, they're, making these small motions that snip grass and allow them to chew. They're not, it's not used as something that interferes with something else. So the head, a limb connects between the body and the ground, whereas the head and neck connects between the body and space for the horse to inspect the world. And then, the most it really interferes with is a bit of grass. But when we put something on their head, we are interrupting the wave motion that comes to the end of the head and neck, kind of like the tail. The tail has a swish, and you see a wave motion through the tail when the tailbone moves. And so that force is carrying all the way down through those tail fibers. The same thing is happening through the fascia up the head and neck. And so when we put something at the head and neck, we interfere with that wave motion. And when we introduce a brace pattern that the horse holds even when we are not connected to the reins, that becomes a part of their everyday life. So all of these structures can be affected. We talked about those cranial nerves and the jaw motion, the TMJ, the connection to the tongue and the hyoid and the bit. You can have a shearing action in your TMJ when you have a change in jaw alignment. And as well as the fact, or you have brace, as you were talking about, a horse that holds their mouth a little bit open, or they grind their teeth. And you can imagine that if you compound...
There's a tongue like between their teeth. That's another one.
Yeah. And if you compound dental issues on top of this, then you're going to have, just there's lots of things can add up. So you want as much freedom and space and openness through the jaw and gullet. Now, stepping away from the head a little bit, you have a connection right down to the sternum and the forelimb through bigger muscles. You've got the omohyoid, the sternohyoid, and you've got the sternomandibular as well. So these muscles, they're running along the underside of the neck from the jaw, hyoid, all the way down to the front limb and the sternum. And so you can imagine that when these structures are under tension and we're also trying to move, so the forelimb is in motion while these areas are meant to have a level of adjustability, this can cause a lot of restrictions. It can cause tension patterns. And all of that can just impact your horse. So I know you've had some observations about the influence of movement of the foot with the fascia of the head and neck.
Yeah, like it's always interesting under dissection when we move the foot, how much movement we can see in the fascia of the head and neck. And so we want that continuum to be able to occur, like between, like what you were saying, between the limbs and the head and neck, and not be blocking it by placing that head and neck in a position, because we're going to actually influence the forces that are then going through the leg. When it's, going through its motion, we might influence the length of stride, or we might influence the way that the foot interacts with the ground. So that's an important thing to consider. The other aspect, which I talked about, the nuchal ligament before, I just wanted to talk about that a bit more, is that when the head is in flexion, it shouldn't, the nuchal ligament shouldn't get caught on one side. And so what sometimes happens is people say, I sometimes have struggled to turn my horse's head and neck in a certain direction, like they seem to get a bit stuck. And what can actually be happening there is that the nuchal ligament is under tension and it's getting stuck on one side of C2. Now, the nuchal ligament has that ability to move across the front of C2 and C1, but we shouldn't see it flicking. And so when trainers say put the horse in flexion and they want to see that flicking, no. Maybe look into your trainer, because what I've noted with dissections is that should not be occurring. And there should not be that amount of stress on the nuchal ligament, and that we're actually going to block the back if that is occurring. So we want the pole to be the highest point, and if C2 is becoming the highest point, then we're putting a lot of stress onto the nuchal ligament and then when it's in that position where C2 is the highest point, that's where we're getting a lot of compression in the facet joints of the neck, especially in those lower facet joints. And I had a horse on the weekend. She kept putting her head to the right. She was in a clinic, and she kept putting her head to the right. And she's also had a lot of trouble with hind end engagement. Now, she had psoas issues, but she also had this area in her nuchal ligament about the level of C3 that was thickened, and probably had some injury occur there. And so the reason that she was carrying her head slightly to the right was because she couldn't actually carry it central. So we first worked on that nuchal ligament, and then we're able to go back and work on the hind end and then start getting it connected again. So the freedom of that nuchal ligament is so important in the ability for the head and neck and the body to go into self-carriage. And then we want this longus colli muscle and the ventral aspect of the neck vertebrae for it and the multifidi on top of the neck vertebrae to be working together to support that base of that neck when the horse is in self-carriage, which means there is no stress on the nuchal ligament. And I think that's really important to recognize there, that if your horse especially is kind of seems like it sometimes gets stuck in one direction and but it's not all the time, then there's probably tension happening in that nuchal ligament. The other thing I just wanted to also mention is that if we've got compression, I think I briefly mentioned it before, but if we've got compression in the upper neck, then it can affect the hyoid. And then the tongue, I said the tongue can sit between the teeth. Well, sometimes you might see a tongue that's sitting out of the mouth a little bit. Or you might see excessive, salivation, or you might see, the mouth opening, which I did mention before, in certain movements. We really want to see a lovely, quiet, soft mouth, regardless of whether you're riding with a bit less, bridle-less. You should not need a nose bend to keep that mouth closed. If you need a nose bend to keep your horse's mouth closed, you need to look at why they're struggling to maintain that position comfortably. You know, what's going on there? Is it a body problem? Is it a neck issue? Is it a hyoid comfort issue? Is it your hands? Is it the bit? Is it a saddle fit? Like, it could be anything, but we just shouldn't need a nose bend to keep our horse's mouth closed and to give us control, because a comfortable horse just won't need that. So would you like to highlight any other areas of dysfunction that can occur?
Yeah, so there's a few. You know, you might see as a result in the body, if we've been overly fixated on the position of the head and neck, is that you can also have stress traveling back through the pelvis, specifically the sacroiliac region, also down to the hocks and the suspensories and the lumbar spine. So all of those areas, you know, if we aren't focusing on how the body itself is functioning and we're only creating position with the head and neck, what happens is it's not just if you don't work on the body, you don't get the results at the head and neck. If you create that blockage at the front, you can disengage the back half of the horse. So, you know, it's quite common to see a horse with trailing hind legs where their pushing position is not in the best alignment for load bearing. And so that puts sort of aberrant strain through your hock. It increases the load on your suspensories. It then, you know, it doesn't lead to healthy motion through that sacroiliac and your lumbar, because they don't end up having a lovely engagement or a nice rounding. And they also don't have, even if they're in sort of a disengaged position, when they do extend, it's not even in a nice way, you know. So all of that is going to contribute to other issues. So it's a whole body system. And often, you know, with those horses, you'll see that they end up sort of getting flat and forward, and they just
or
kind
they
of
use their legs. So you'll see
Yep.
like a flashy limb, especially a flashy forelimb, you know, motion happening, but it's not the whole body's not connected to that forelimb motion. So there's like the forelimbs are doing this flashy movement, but it's not a connected movement that looks like it's a whole body motion, if that makes sense.
Yes. Yeah. And there you often lose your adjustability throughout your gaits as well. And just the ability for the hind limbs to step under is just really blocked. And often, you know, it's combined with either a braced core or a weak core, and they'll end up with a bit of a belly that doesn't look like it's creating a nice connection between the front limbs and the hind limbs. So if you were an owner and you've thought, okay, I want to change how I'm doing things, or I want to check that I'm really serving my horse, what are you going to go out and have a look at?
First of all, I would set up your video and I'd video yourself riding. And I would step outside of it being my horse and me in that video, which is a hard thing to do because we all have rose-colored glasses. And I'd, you know, analyze it. I'm just having a look at the biomechanics of the horse. First of all, I'd just have a look at the facial expression. So, you know, does there seem to be a fair bit of tightness around the mouth? How are they holding the mouth when I do certain movements, especially transitions? I'd look for any, like, what's the tongue doing? I think a soft, quiet mouth is an optimal mouth. I know there's other trains of thought that look for a lot of jaw motion. For me, I don't see the softness in that at times. So I'm looking for a quiet, soft jaw and mouth. also when you're riding the horse, have a look at, does there seem to be brace in the lower back? Does the base of the neck look lifted? Do the limbs look like they're moving independently of the body, or do they look like they're creating like a whole body connection? I'd also have a look at the muscle balance, because a lot of horses that aren't using themselves optimally have a bigger under neck and a smaller like bulk of the neck muscles. They can have a weaker top line, so they're not filled up through the base of the wither. And they can have weaker, floppier quads and then bigger hamstrings, because they can get that bigger motion, but it's through like limb movement, not through like whole body spine connection to the limb movement. So they're often not kind of balanced in their muscle balance, which we've done an episode kind of talking about muscle balance before. I'd also notice that if my horse feels like they're being held in the position, and what happens when I do give the reins, does it feel like they drop? Does the balance feel like it drops forward? Or, do they still feel like they're pushing from behind? And what happens if I stop riding? Like I just, so I keep rising to the trot, for example, but I stop pushing. Does my horse just stop? Because a horse that's in self-carriage, if you're not pushing, you're just rising, they generally will continue in that motion. And then recognize signs of fatigue. For example, they were holding it, they did feel light, they did feel supple, they did feel easy, and then they became a bit like lower in their head carriage or higher, or a little bit heavier, or they felt like a bit inconsistent in their stride. And we want to avoid judging this engagement by the head position alone. Like we want to look at how the entire body is involved in that horse's biomechanics. So, yeah, I think it's just kind of standing back and being a bit objective of your horse and ridden, and and looking at other horses, not to be critical and judgmental, but just for learning what it looks like when a horse is in self-carriage. And people like Manolo, Terza Hendricks, Tori, Jeffries, there's some examples that I can think of off the top of my head where I've seen horses that are in a much truer self-carriage. So what kind of takeaways would you like to highlight here?
That the overarching theme is that there is a difference between head and neck flexion and full body self-carriage, and learning to recognize the difference means that you can judge whether what somebody is helping you to achieve with your horse. You have a trainer or a body worker, whether you guys are on the same page if you are looking to create true self-carriage, and being able to reflect on where your horse is at and how you are influencing them with the work you do. If you're taking them forward, so the ability to make that observation over time, but also pre and post work, judging your fatigue and just seeing, how does my horse feel about this as well? What does their face tell me? How is their way of going? And also just giving yourself the room to say, okay, we're butting up against some things here like mouth opening, popping the tongue out the side or teeth grinding, and being able to say, okay, I'm going to step back and come at this from a different perspective or figure out why this is happening rather than trying to make it happen. So yeah, just the awareness that it will come when the other things have aligned and your head and neck is a result of the rest of the body.
Yeah, and I would add to that, recognizing that to build appropriate self-carriage takes longer, and it takes often a lot more time than what people are willing to give it to condition a horse appropriately, and that they fatigue a lot quicker initially than we also recognize. So making sure that, if they have done some really nice work where they felt really light, giving them a good break and figuring out what your horse needs in the break, whether it's like standing and stopping completely, or whether it's kind of letting them stretch out. And it probably depends on what surface you're on as well, because sand surfaces can be much more fatiguing, so they might need a bit more of a just standstill break. But just recognizing that creating kind of interval type work in building that is very valuable, and giving them a lot of rest, and recognizing that when we go out to compete, we're often asking them to hold these positions for much longer period of time, and they're often getting fatigued, and that's where we're kind of setting up for wear and tear and potential injury if we're not giving them enough time to have breaks. So awesome. Well, thank you for joining myself, Dr. Raquel Butler and Sophie Vandenberg, in today's podcast. Enjoy your horse time. Please subscribe to the Equine Functional Posture podcast so you don't miss our weekly episodes, and give us a 5-star rating so we can share more valuable insights. Reach out with any listener requests for topics that you'd like to hear us talk about. And if you're a business aligned with our mission, then reach out to become a sponsor of the podcast.
And we'll see you in the next exciting episode.